In this video, we're going to be going through exercises for gluteal tendinopathy, but actually exercises that are probably a little bit more challenging, especially for those that want to get back to running and a performance or an exercise level that's a little bit more advanced. So we're going to dive into it now. Now, historically, pain around the side of the hip here has always been referred to as bursitis. And as I've discussed at length in another video, which I'll link here, we don't really often see bursitis as a primary problem. What we deal with here when it's around this area is something called gluteal tendinopathy. Now, a tendinopathy is something that occurs usually as a result of something driving that response. What we're going to do in this video is predominantly go through some exercise choices that are probably a little bit more challenging and ones that you would maybe do at the latter stage of rehab in order to allow the hip to tolerate exercises that are a little bit more robust and a little bit more guided towards getting back to exercise and, performance of maybe running or something similar to that. Now, often in the early stages, the hip, when it's irritable, will struggle with movements like this, which is called hip adduction, especially if it's quite irritable. But what we don't want to do is avoid that for too long during the rehab journey. So as things start to progress, we want the hip to become more tolerant to this kind of stretch movement and this movement, where actually in the early stages, those might be the things that we tend to avoid to allow it to settle down and so we can start to build it back up. However, as I said before, as things are progressing and we're wanting the hip to become a little bit more tolerant, we start to introduce exercises that may actually have the same kind of movements that we might have actually avoided in the early stages. And that's what I'm going to go through here today. We're going to go through a couple of exercises that I find can work so well, but you have to make sure that you just use it at the right time and dose it in the right way. I need to caveat all these rehab videos by saying that this is never going to replace someone being able to help you face-to-face or online or giving you that one-to-one support. So if you really are struggling and you're not getting the improvements that you want, definitely seek help. However, let's get into it. So the first thing I'm going to go through is some of the kind of principles or what we're trying to do with these exercises. As I mentioned before, we've avoided a lot of these movements and these movements up to this point, but now we want to start to kind of introduce it. Now, the best way to do that for me is these exercises here. Now, the curtsey lunge is a great exercise. The curtsey lunge is where you're balancing on one leg, you're doing as it sounds there, big curtsey down to that side and then coming back up. But it's quite a hard one to do. So we have to be able to build up to that point. Now, the way that you would do that is to break it down into the movement patterns that will be as effective as possible to enable you to get to that point. I'll show you now. So first and foremost, what I would do is not necessarily using the slider platform, but just using a slider as a marker. We're going to use this leg as our working leg. You're going to balance on that leg. And I just want you to do like a little mini lunge back. But that lunge is being done so I could just tap that point there and coming back up. So you're just reaching out, keeping it fairly linear to start with, but getting the hip used to that movement. You could do that, 8 to 12 times, see how it feels. You don't even need necessarily the marker there for this one. You just want to be able to go back, tap, and then come back up. But what we're starting to do here is introduce a little bit more of a stress. And as you see, as I come down here, if my knee is straight, then that's great. But I'm still going to be putting on a bit more load around this lateral hip that possibly you've avoided in the earlier stages. So you just want to get used to being able to do that confidently, more importantly, without it being too irritable for that patient. Now, let's say, for example, things get a little bit easier, a little bit more tolerable, you can manage it a little bit better. What we want to try to do at that point is introduce some multi-directional movements that are similar to what we've just demonstrated there. And this is when the sliders can become really useful. Have the slider behind you. Again, we'll use this leg as my kind of leg that I want to kind of work on. Standing on one leg, reaching back to the slider and starting to aim for the opposite corner. So here, now my leg is coming out almost like towards my right hand side, past my midline at the back, and then bringing it back up. We'll try that again. So balance, down, opposite side, and back up. And you can see how actually that stretch that we had from the first one is starting to be even more apparent now. And you just want to repeat that, again, relative to the individual, But you can also vary it with the back one that we did, but you just really want to start aiming to get to that point. Now, this is where things need to be kind of really tailored effectively to get the most out of it. If that's getting easier, this is where things start to get fun. We do the same exercise, but rather than going to the corner, now I'm trying to go all the way to the side and then back up. All the way to the side and then back up. And this is actually quite a tough exercise to do, but you have to make sure that you're doing it right. And this stretch here is great. So like I said, although at the beginning we were probably avoiding these things, this is the stuff that we have to do to be able to build up the hips tolerance for the exercises that we want to put it through, in particular, whether that's running or even in the gym. Now, following the same principles of what we've said before about just trying to get this pelvic stretch and stability control throughout these exercises, the next one is going to follow the same protocol principle like we've discussed with that one. Now, this one, we're going to actually focus in a slightly different load profile in regards to what we did before. So where before this was the injured leg, let's say, sorry, not operated leg, let's say this is the injured leg that you're stretching. Actually now this is the one that we're focusing on, and the slider is on that right leg. So what I want to do here, keep my back nice and straight, nothing too crazy, but just decent form. Drop your bum back, and this leg is now sliding out. Now as this leg slides out, this one is naturally going to add that level of stretch that we're talking about, which is referred to as kind of a compressive load on that greater trochanter, which is that bony landmark that sticks out the side of your hip. You want to just try and go down as far as you can and then back up. And as you're doing this, see what is most comfortable for you. Foot position here, does it point out a little bit? Does it kind of point straight? Just do whatever feels comfortable for you for the exercise. Just make sure that it's controlled. Don't rush it because it's dangerous, obviously, because you're on a slider. Also, when you're doing it, don't like lean forward too much like this, because you don't get the benefit that you want from it. Just keep your back nice and controlled, nice and straight. Reach out. You'll feel a stretch here in your adductors as well. That's pretty normal, so don't feel like you're doing something wrong. But really what you want to do is do the exercise, really load up this side. As you're doing it, try and feel the response from an exercise that you would anticipate. What you don't want to do is irritate your pain. You don't want to flare it up. So let's say you're doing your exercises, 8 reps, 10 reps, 12 reps, day 1, day 2, and then it's starting to flare it up. You might still be not necessarily doing something which is wrong for it. It might just be the dosage that's slightly off. So in order to understand how we would monitor that, you do the exercises. If it's flared it up, possibly drop it down 20-25% in your total volume of what you're doing. Have a rest, do it again, and actually has that reduction in dosage elicited a better response to the rehab that you're doing. Now, I know loads of you that are watching this started the video thinking, I want exercises that are going to be challenging, and this may well be. However, the last one is going to be where we start to really get a bit meaty with some of these exercises. I want you to get a decent size weight, probably a 5 kilogram, something like that, depending on what your strength levels are. If you're going to be working on your left leg, I want you to hold the weight in the opposite hand. Basically, what you're going to do is 2 things. 1, hold your balance, and with your opposite hand, reach down until you get to a point where you can feel that stretch, and then come back up and try and hold your balance with this. So controlling with that stance leg, reaching down across your body and coming back up. And then to work the opposite side, you would do the same thing. Balance on one leg, reach down until you can feel a stretch, and then come back up. And obviously you've got to make sure that you can do this, you don't have any back issues, etc. Stance, almost like have a bit of flexion in the knee. Doesn't have to be too rigid, but like a bit of a bend all the way down across your midline, coming straight back up. Hold that control. This is doing all the work I want it to. But look, as I come down here, and as my body is coming across, as my knee is probably deviating inwards a little bit, we're actually starting to get that same stretch here that we discussed is the whole point of why we're trying to do these more compressive, more challenging type exercises. Just hold that control, cross your body, and back up. And then you'll see how those go. You might find going to floor level is a bit hard. So you could do the same exercise, same weight, but just maybe have a box or something that's of a higher level to see how that goes. Now, if you're doing those and they're too easy or they're too hard, it might just be that this isn't pitched at the right level for you. So you need to find something that suits your needs. And more importantly, if you're doing these, oh, I'm out of breath. If you're doing these and you're finding it useful, or you found them too challenging, comment below and let me know how you found them. Hopefully by that point, I've caught my breath.